Hi, everyone. It's Dr. Jim Augustine, another week of DocTalk. This is getting towards the end of January. A lot of weather moving across the country, a lot of winter challenges this time of the year without COVID. We would be busy. We would be managing a lot of snow and ice events, cold weather, buildings on fire, and people sick. This winter, we've got a couple additions to that. So flu in some ways is spreading across the country now. If you read your local public health reports and the CDC reports, you will see that there is flu in the country. Not big wide outbreaks. It is influenza A, and it's type H3N2, which has been circulating for the last 3 winters. So it even predated COVID, just so everybody remembers that. And influenza A, H3N2, causes some pretty significant downtime for people. They feel crummy. They have coughs and colds and sometimes get hospitalized, particularly if they have underlying diseases. So be aware that that is moving somewhat across the country, nowhere near the volumes from prior years. So don't let anybody scare you. And for H3N2, we have the flu vaccine this year that has been successful and includes that strain. So for those of you who still want to get a flu shot, they're still available and it is still effective. Of course, what else is going around is the Omicron variant of COVID. And it's really frustrating for a lot of you and a lot of our members because there are quite a few people who have gotten breakthrough infections or reinfections if they were never vaccinated. Very fortunately, I'm here to tell you this week that all of the science tells us that breakthrough infections or reinfections are not as serious and very infrequently end up in hospitalization or death, particularly in people without underlying medical problems. So even within my own family, we've had a breakthrough infection. And if you will, Omicron almost acts like its own little strain of coronavirus. And even if you've had the prior versions, which we'll call the Alpha and Delta versions, the Omicron version is so unique and so infectious that it occasionally will catch people who have been vaccinated or infected before, and even if they've had both infection before and vaccination. And in particular, in people who have underlying medical problems that impair their immune system. So don't be frustrated. Frankly, don't be scared. And another indication that our vaccine programs work. And then honestly, this week, the literature says boosters work even better in preventing any infection and certainly against infections causing hospitalization. So for those of you who have relatives, members, family that are at risk, the strategy still is get the original immunization, get the third jab, if you will, for boosting. And that works very effectively in preventing serious infections. All right, the news of the week really is that nationally, Omicron appears to have peaked. And in many areas of the country, I'm looking at a lot of our graphs, and the numbers of cases are going down. The numbers of hospitalizations have either stabilized or are going down. The number of deaths, the lagging indicator, the number of deaths is still going up. Don't let that surprise you. That's the way it's been throughout this coronavirus outbreak, no matter which of the variants is circulating, that the first thing that goes up are the cases. The second thing that goes up are the hospitalizations. The third thing that goes up are the deaths. So that hasn't changed in any of the waves that we have been through within coronavirus. So here we are in January, and we're trying to look into the future and see what's going to happen. Well, nothing has been predictable so far, so don't count on anything being absolute, but it is really good news that Omicron has swept so quickly through our population, through our healthcare system, and through our departments. Many people have been sick. From looking at other countries, we are seeing that people who have been sick seem to be very well protected with high levels of antibodies against all forms of coronavirus, any of the variants. So that's good news. Number two, it appears very much that this variant is not as serious, doesn't cause as many people to be hospitalized or to die. That is really great news. And we're getting more and more indications of that as each week goes by. What we are doing now is looking at other countries and hearing from them as they have gone through the Omicron wave and have come back down. So listening to the UK, listening to South Africa, listening to other European countries right now, they had the same rapid uptake and rapid downturn in cases. At this point, their hospitalizations are slowly going down. Their deaths are slowly going down. But the countries are opening back up again, even in the middle of their winters, if they're in the Northern Hemisphere. Our South African compatriots who we talked to have said they've had no new waves, and they are so far into this now that their death curve has gone down very significantly. They're trying to reclaim their hospitals, get back to some day-to-day work. Boy, wouldn't that be a nice thing for us to be able to do, get back to our day-to-day work. The UK and much of Europe that have been through the big peaks are opening up as well. So what do we have to learn? Well, one thing we learned this week is that Omicron was in this country earlier than we thought. And we have found a really nice gold mine for us to look at outbreaks and where cases are occurring, and that is in the wastewater. So gross part of the discussion here, they sample the wastewater that's coming through the sanitary sewer systems. They find the levels of waste that contain the virus. They now type them to see what type they are. And, we had this huge rush of Delta in the wastewater in bigger urban areas. They also found at least 2 weeks earlier than we thought Omicron was in the United States, that it was present in the wastewater. And so it was here. It was not causing, any big spikes in terms of infections in those urban areas, but it was present. That says we're a little ahead of the curve in terms of what we're going to do peak-wise. Around the country, since this goes both nationwide and hemisphere-wide, we're still going to have systems that are up higher still that got a later wave of Omicron, and they're still going to be crunched. Other areas, particularly in the northeast part of this country, are already coming way down in the waves. That's really good because then we're less worried about schools, we're less worried about our hospitals being beyond their surge capacities, et cetera. It's still wintertime though. So as we watch Omicron and coronavirus go down, reopening means all those other bugs will start pestering us again. So we will have RSV in the kids. We'll have strep. We will have pneumococcus and all of the routine causes of pneumonia that come in the middle of the winter. So we still have a concern about those. Masks are still going to be worn by a lot of people, and they probably will be worn by a lot of people through the rest of this winter and until we get to the springtime. There's two reasons to wear a mask. Number one, still effective against many of the cases of coronavirus. And so people who are concerned about it will continue to wear the mask to protect themselves from getting a big bolus of coronavirus coming into their respiratory tract. Number two, many of those people, including me, have realized this protects me against other kinds of respiratory infections. And that's really kind of nice. I like not being sick during the wintertime with other respiratory diseases. And by me wearing a mask and being around other people wearing a mask, I have been protected for 2 years, and that's a good feeling. So as we get through the next couple of months, we still in many areas of the country are going to be fully protected with PPE and N95s. We'll be social distancing. Certain staff stresses are still going to be ongoing, where you have some waves of people who continue to catch COVID. You can expect, even if you're past the COVID peak, that there will be other respiratory infections that can still occur in your department. People will still need to get tested for them, whether it's COVID, flu, strep, or another bug. And so those still in North America are infections to come. Number 3, you'll start to think through and hear about what is opening up, and you'll have to work through in your mind what your risks are and what you can do to protect yourself, so that you don't pick up anything before the nicer weather gets here. Number 4, we are at a point where people are going to be thinking about de-stressing their workforce. And so looking perhaps April and May at what you might do to improve the life of your members is probably good timing. And think about ways in which people can get vacations, they can get caught up with things that they enjoy, they can go do some educational things that they enjoy doing. We believe starting April, May, and June in most parts of the country that we will be past the coronavirus waves, and we'll be at a relative lull, and at a time where people can begin to think about taking a vacation, taking a break, and then planning ahead really for what the next steps are. Next steps in many cases are hard to think about when we've been through so much of this and are kind of waiting for the next blow to arrive. Nonetheless, we have some gaps we got to fill. We got to recruit people into our industry. We got to rebuild our hospitals and our health system. We have to think through our major incident planning because we have wildland fires and tropical storms and other things that are going to come our way. And we got a workforce that is just exhausted. And they've been through a lot. Their families have been through a lot. Schools haven't been regular. They haven't been able to do their enjoyable events. Their families haven't been able to come together. And this summer may be a real time to do that. And so in my departments, we're already trying to plan ahead for what a quote normal summer might look like and how we can make sure that people get to come down to baseline levels of enjoyment of their job, and that we can go back and recruit people into our wonderful industry. Best job in the world is what we get to do, and think through what that might look like in the next evolution. So some good news to deliver this week, not a lot of really bad news, and we have a lot to look forward to because we believe Omicron, with its very widespread, may give us the protection that we need from other big waves. In the future weeks, we'll talk about what endemic looks like and how we tolerate that. And there's still low levels of, you name it, tuberculosis, measles, mumps, sexually transmitted diseases. We just move through and accept them as part of our life. We don't get them in such numbers that they stress the health system, and we kind of manage those little waves. And then, every winter we get through the respiratory disease wave, and we do it successfully and move on to the next spring. So here we are in the dead of winter, and we're looking forward to the springtime and summertime. And we have some planning to do, but we can do it in a very optimistic way. So this is DocTalk, third week of January, but a time when we're looking ahead. And I hope you all stay healthy, and I hope you look forward to good times ahead. Thank you all.